Welcome to Uncle Talks podcast. Join three experienced doctors, Dr. Kenneth Tan, Dr. Leong Chun Kit, and Dr. John Siang, as they discuss medicine, health, and wellness from a uniquely Singaporean perspective. So, hi everybody. We are here for our first episode of Uncle Talk on anything about health or around health. So today we're going to talk about medical school as well as anything about and around medical school. There are three of us, so we'll introduce ourselves first and then we'll continue talking. So we'll start with Kenneth.
Hi everyone, I'm Kenneth. I'm a private GP running a clinic in Punggol, and I'm also involved in medical school, as being an assessor at NUS, and also secondly as one of the tutors for the undergraduate program. Next, John.
Hi, I'm John. I'm one of the private practice gastroenterologist. I work in Farrer Park Hospital and Mount E Orchard Hospital. And this is a great initiative to talk about things that's related to health and not necessarily deep dive into our own specialty.
Right, okay. So my turn to introduce myself, okay. I'm Chun Kit. I'm also a GP like Kenneth. I have graduated since 1991. Just like Kenneth as well, I'm also a teacher in the school. In fact, all the three medical schools in Singapore. And I've seen many pre-medical students coming to me to ask for advice to get into med school. And of course, a lot of the things we said may not be specific to any one person, but definitely it will cover a wide range of possibilities to get into medical school and why one would want to choose to be a doctor. Right, so even as we begin, maybe one of the things that we should talk about is why each one of us chose medicine as a career. Maybe Kenneth, you think? Start first. Yes.
Well, I mean, I think medicine is a very interesting career. I felt that when I was at the point in making a decision on my career after JC, in my NS period, I was thinking about what can I do that makes the greatest impact on society. And so I felt that out of the technical arts, the technical sciences, right, you could do computing, you could do engineering, but medicine is something that marries both the art of caring for a person with the knowledge that you need for a technical skill. Yeah, so I felt medicine was something interesting for me. And the second thing is, after I went into medicine, then I realized there's a lot of scope for you to be contributing in terms of tech, in the world of tech, because everybody wants their healthcare to be delivered as high quality and as high tech as possible. So that's where I feel that I made the right choice. When I went into medicine, I'm able to also improve the technology, and that has really changed the practice from when I first thought about entering medicine to the medicine that I'm actually practicing right now.
Right. John, we know that he's technically is a foreigner, right? Yeah. So
yeah, that's right. Yeah.
So John grew up in New Zealand, right?
Correct.
And then you were educated in Australia.
New Zealand.
New Zealand also. Okay. And only you came Singapore as a doctor.
As a specialist.
As a specialist, right?
Yeah.
Yes. So what is your experience like, and why do you choose medicine growing up in New Zealand?
I think when I was 17 or 18 years old, trying to enter into university, I was trying to figure out myself what I wanted to do.
Right.
So during my final year in high school, I did a lot of fine arts, graphic design. So I was trying to aim myself to get into architecture. So I was applying for school in Melbourne, Auckland, and my dad took me to see some current architectural student at that time and asked. So my question to them was, hey, how was the job prospect? Do you enjoy life? Do you enjoy being an architect? A few of them basically said, it's quite busy. You don't get to sleep, and there's a lot of desk job where you sit down and it's not very in terms of the job, it's not very vibrant.
Right.
So then I thought, okay, I wanted to leave the house and get away from my parents. So I learned how to grow up. So I went to Dunedin because my University of Otago at that time with my friends. So I just to get away from parents. And so at that time, my intention was doing dentistry because my dad said dentistry is quite good. You know, you earn a lot of money and all that. But so when I get in, first year medical school was basically a health science where everybody learned the same thing.
Yes.
Your pharmacists, your physiotherapists, dentists, medical students, they all learn the same thing in the first year. And then I fell in love with biology. Okay, maybe I could do biology. I never done biology in my life in high school. So I thought, okay, this is quite interesting. Maybe I just get into medicine because this is a very interesting and very wide field. Got a lot of different things you can do, and maybe I'll just do that. So I think after that, I never turned back.
Right. So New Zealand have a slightly different medical school system compared to Australia or UK or Singapore. You do a 1 year common academic year before you choose medicine.
Yeah, so in University of Otago in the South Island of New Zealand, you don't do you don't get in basically with your academic results from your university entrance exam. Whereas at Auckland University, they had interviews, but I didn't apply. I never thought I wanted to stay in the same town as my parents and just live there and grow up. So I thought I wanted to leave the house and just get away from house and just try to grow up. Yeah.
Right. Okay, my own story. So I came from a relatively good JC. So did quite well. I was actually on road to applying for a PSC scholarship to be one of the scholars in Singapore at that time. Yeah. So, but many of my classmates at the same time also applied to medical school as well. So I just decided I just go along, and I was in the officer cadet school doing infantry officer course, and at that time, those days were quite tough, right? So towards the end of my junior term, I still remember. So I was asked this very weird question: will you want to continue in the scholarship application, or would you want to do something else? So the smart part of me must be thinking, why that question all of a sudden, right? So I figured out that I might have been considered into medical school already, and so I decided that I would rather have what is in my hand than what may or may not come. Right, so I decided to just take the chance, and then told the officer that I would just, get whatever it comes. And true enough, I got into med school. That's how I got into med school.
But did you know what you wanted to do? Before you try to apply for medicine?
Well, I do have a few options. One of the options, of course, is medicine. The other one is dentistry, just like yourself. Yeah. And the third one is, actually it should be the second and third. My first choice was actually wanted to do Chinese. I wanted to be a Chinese teacher.
Oh, that's interesting.
In fact, the PSC scholarship that I applied to is to do a degree in Chinese teaching in Beijing, China.
Oh, wow.
Yeah. So I was gunning for it. Yeah. So that's my story. No high and fancy kind of calling at that stage. Yeah. And thankfully they didn't ask me anything about that. I was just very naive and just say whatever comes to my mind at that time. And for whatever it's worth, they have considered me into med school. Yeah, so that was me. Right, so since we are talking about getting into med school, we know that now there are many paths that go into medical school, and Kenneth, you have actually done the assessing part for undergrad. Maybe we want to share with us what are some paths that lead to the local school, medical school entry.
Well, I'm not so familiar with the paths for local medical school entry. I think generally people submit their applications. What we know is that NUS has a lot of applicants every year, and then there will be some screening through your portfolio to decide how many of the applicants will actually go for the in-person interviews. And then in terms of the in-person interviews, there will be you'll be scheduled on certain days where you come and there'll be some assessments that you do solo. There are some assessments that you'll do as a group, And then there's an interview session where we'll try to find out and learn more about you. But generally, each assessor is just contributing their assessments of you, a small percentage, and it's actually your total performance that will determine whether you're offered a position or not.
I see. Yeah. So I remember most of us got into medical school through the A-level routes, right? So we did A-level at that time. But I think that today, the so-called A-level, there's also the IB route. Yeah, you do the IB exams, and then of course the criteria are a little bit different, but by and large, it's very compatible, right? So I guess 90 pointers are for the A-level students, and then 45 or so for the IB students. So that would be it. But I also know that in medical school today, there's a certain percentage, I just can't remember the percentage now, a certain number of them coming from polytechnic route. Yeah.
Yes.
So I think they must have at least GPA 4 in whatever they do. The subject, apparently the diploma doesn't matter. So it can be even from non-medical courses.
Yeah.
Yeah. The other one is actually Duke, because I also teach in Duke. So Duke is a postgraduate course.
Duke-NUS.
Duke-NUS, that's right. It's a postgraduate course modeled after the Americans. So this is a 4-year course meant for the undergrad. So in other words, there's another path. That means those of you, or those are the people that you know, when they ask you, that means they have a degree in anything, and then they can apply to Duke as a postgraduate medical course. In Australia, it's the same too, because I've heard of people having bachelor in music, bachelor in arts. I have even heard of one student bachelor in theology, to get into the medical school. Yeah, so those are, at least I know some of them there. Is it in Australia or New Zealand? Is it the same as well?
Yeah. So people can. So when I went into medicine, we had a lot of postgraduates, about 25%. I remember there was one guy who had a PhD in chemistry,
right?
And there are some Bachelor of Arts students. To me, I don't know. I just feel when they go into medical school, they bring a degree of maturity. More logical and more common sense than your high school graduates.
Yeah, yeah.
And I think after being training some of these students and medical students in restructured hospital, I find that the Duke-NUS students do bring on a degree of maturity and responsibility, compared to the NUS students.
Yeah, that I noticed too. When I take the students, they are what I call adult learners.
Yeah.
So they're more serious in their work, a lot more committed. Yeah. And probably in that sense, given a second chance to get into medical career, so they probably treasure it a little bit more. And like you say, maybe because they're older as well.
Yeah.
Have you heard of the twinning program?
No.
Have you heard of the twinning program?
No.
No? Have you heard of IMU?
Yeah.
IMU?
The Malaysian International Medical School, is it?
International Medical University.
Yeah.
Yes. So there is a training program, another way to get into medical school. So you do a pre-med in IMU, and then after that, with that result, you train with one of the overseas university.
Yeah.
Then when you graduate, you will get a degree from the twinned university.
You're bonded, and you have to go back to Malaysia.
I'm not sure about that one. Is that
so
right?
we do have some of those IMU students in New Zealand. They get bonded. They have to go back to Malaysia to work.
Why should they be bonded? Who pay for them?
The government.
Oh, it's the government that pay for
some of the government scholarship that sends them out.
Okay.
Unless you break the bond.
Okay. I'm not aware of the bond part. Yeah, but I think it's interesting because at least we cover a spread of different pathways to go into medical school today. Yeah. Have you heard of foundational school?
No.
You should have, right? From Australia.
No.
Okay, this is what I understand. Some of the students from Singapore, so they will apply through an agent to a college to do what they call foundational courses or class. Yeah,
like a pre-university, post-high school kind of 1 or 2 years.
Yes, and then they take the Australian exams, and with that grade, they will actually get to the Australian medical school. Yeah. And some of the Australian medical school actually have training programs with this foundational school. I think the more common ones will be in Sydney, Melbourne, and all that. I think almost everyone has one, but the more common one is Sydney and Melbourne. Yeah.
See.
Yeah. Okay. So, right. So, next thing, as we look at application to medical school locally, we know that at least the 2,000 or 3,000 people applying for the school, they are all 90 pointers. In other words, they are all full marks.
Yeah.
Right. How would you advise anyone to have a leg up or a hand up? How to differentiate yourself, in other words? Since you have done assessing before, is there any such things? Not just tips, but any such criteria?
Yeah. So, well, what I realized is after meeting all the candidates, right, most of them are excellent. I don't think there's a poor candidate out of all those that we've I've met. Yeah, but I think what differentiates the really good ones from the rest is that the really good ones tend to have a particular mind. They are very clear what their purpose of applying to medical school is for. They have thought through quite a number of the ethical issues, quite a number of the principles of medicine, and so they come prepared. And in terms of their life story, when you look at their portfolio, then they have served at some leadership positions, or they have tried to volunteer, or they have gotten some kind of increased exposure to medicine, so they've done attachments to clinics, to hospitals. And so I think those are things that differentiate them, because when we talk to them, we realize that they have had some relevant experience or relevant exposures to healthcare, and then that helps with their answers to us.
So what's your experience, John?
Nothing really, nothing. I think I was fortunate to choose medicine as a career and never turn back. I think I just, maybe I'm adaptable, but I just feel, if I have to do it again, I wouldn't choose anything else. I would not choose any other career.
Yeah, same here.
Yeah.
Me too. But for the younger kids now trying to get in, it's very competitive.
Correct,
so that's why they really need that extra age. Yeah. But yet the extra age is not known. Even I think for all of us, as we say all this thing, I don't think we know for sure which particular part gives you the actual addition.
Okay, let me ask you this, because you two are assessors. I'm not, right?
No, I'm not an assessor. I did the postgraduate one, but not the undergrad.
So
you
really? So as a very experienced in screening these students, what are the top 3 characteristics in terms of the person that you look for as the X factor? Then you know that this guy, when he grows up, exits medical school, when he graduates, he's going to be a good doctor. Do you have a top 3 characteristic or personality or anything that you feel this is the X factor?
Yeah, so when number 1 is that the assessment is actually quite rigorous. They're looking at various domains, right? So whether they have good values, whether they are good leaders, whether they are, there are certain traits that they are looking for as a program. But for me, when I'm looking at those candidates, what I'm looking for is a person who's very calm, who is actually very confident in what they do, and then when they respond, they are respectful and they have gone through their thought processes before they reply. And it's okay if they make mistakes, in reasoning or in their answers. But I think most important is that they have done the reasoning, they have done some consideration before they answer.
For me, although I've not done undergrad, but I've taken a lot of pre-med students, prepared them for interviews and all that. My first advice for them is always seek their own heart. Why must they seek their own heart? Because as you all know, as doctors, after so many years, right? We find that actually, no matter what difficulty you go through or temptations and all that, it's the heart that carries us through. Even in the darkest hour, in the most difficult night call that we have with many collapses, what what makes you carry on, even when you're very tired, you still continue the resuscitation and all that, is basically our conviction in the heart. Without that, it won't work.
So resilience.
It is resilience.
But how do you test for that? How do you assess that? How do you figure out whether this person is resilient, is strong, strong-willed? How do you test
Well,
for that?
I think it's difficult, definitely,
Yeah.
and it also can be fake in a sense. But at least I think in the current system, we can look at the testimony that the potential applicants have written, and even as we interview, we can check and see what the motives are. We can't be 100% sure, but we can definitely sieve out a lot. The second group will be whether we can figure out whether they're team players and whether they're independent but they're team players. It's a very unique kind of combination that we have. Because if not, then they can't survive in the modern medical system, right? You need to be independent, but yet you need to be a team player. So I would look at the passion and the interest they have. For example, if they play a team sport, or they play some music, but in a band or something, they form their own band, more than they say volunteer in the meet the people session, you know. That one is nice watch, right? Yeah, or even attachment in the clinic. Yeah, but really doing something may not seem very significant, but those are significant to me. Yeah, and then maybe lastly, we look at whether they are on their own, or is it because they're coerced by their parents or guardians to do medicine because there's some myth that doctors always earn a lot of money, right?
Yeah, that's right.
I mean, from the clothes we wear, we know that we are not earning much money. Yeah, right. Also, the other thing, have you heard of this business about tuition?
Yes.
Giving potential pre-med students tuition so that they get into medical school. So, what do you think of it?
I think that you do not get, you should not receive tuition to decide on the career you want to do for the next 30-40 years. Particularly getting a tuition to learn how to say things in interviews does not reflect your true self. I've heard that. I mean, I've heard from some professors that in the interview they look for honesty.
Yeah,
honesty is probably the most important thing, and morally ethical person to be a doctor. Yeah.
So, kind of, what's your view on this tuition thing?
Well, I think number one, if you're going in for an interview, you should be prepared. So, how do you get that preparation? I think it's really up to you. So, I remember when I was going for my medical interviews, I was preparing. I was actually reading books in the library about how to prepare for interviews, and I think that really helped me for my interview process. Now that this, I think coaching and interview preparation has been around for many years. Actually, it's a service that you can buy, but when we meet people who have been coached in the interviews, it is very obvious that they have gone through some kind of coaching because their answers are all very similar.
So, why do you want to be a doctor? Because to save my grandmother.
So I think it's good to know the skills and be exposed to the skills, but it's important to practice it and make it yours so that your answers sound more natural and more honest.
Right. Since we're at the topic of interview, so what are some funniest, dumbest reply that you have heard of, or you can think of in your case?
I mean, do people that you've heard in the interview, when you ask them, why do you want to be a doctor? Do people say, I want to be a cardiac thoracic surgeon, I want to be a neurosurgeon?
Well, I used to say that, you know.
Yeah, is it?
Yeah. I did say that. Yeah. But I also said that I don't know whether I can make it or not.
What is the corniest you've heard?
I don't think it's about cornea. So far my stations have been more about asking them to work together, teamwork, asking them to do certain things. So I don't really do the part that you are mentioning. Why do you want to be a doctor part?
So when you do the station, right? Do you rate those people who are quieter, who doesn't speak as much, who are not so verbal, lower mark than those people who are very verbal?
I really look at how they play a part in the whole team exercise. Like, it's not about whether you are very verbal or whether you are not so verbal, but we look at whether you have contributed to the team's progress as a whole. Yeah, because there are some people who are very verbal but lead the whole team down the wrong track. There are also people who are very quiet but persuasive enough to get the team right back on track.
It's like doing a school project, isn't it?
Yeah.
When you have a team, there are people who talk so much and they don't do anything, and other people just quietly do things.
But you can tell that the person who's talking a lot has been trained to talk a lot. So they're looking at the clock, they're like, oh, I haven't said anything in the past 30 seconds. Time for me to say something.
But in reality, that's a reflection of what they do in hospitals. This is what some people do, right? Some people just talk a lot, they don't do anything. Yeah, I don't know. In structure, some people talk a lot in the department, they don't do anything, and some people just quietly do their stuff and get things done.
I'm thankful I've not encountered anyone like this.
I think a lot of it is personality, so I usually mark it down to personality. They don't score more marks or less marks based on their personality. So, but I feel the content that they're bringing to the discussion is what's valuable to me.
Yeah.
But I find in medical school, or when a group of doctors, when they graduate, you need to have some vibrant personality. You also need some who can work along, who are quieter, and who I think it makes you cannot have. I mean, we know that surgeons are very vibrant, right? Very lively in their personality. But you cannot expect a whole cohort of graduating medical students who are all surgeons. You still need some people who are quieter and do their own things, isn't it?
Yeah. And there are certain disciplines that don't require you to talk at all, right? Like pathologists.
You still do. You still need to communicate with your colleagues. Yeah.
Or anesthetists for that matter, you know? Yeah.
I mean, to me, I feel that as an assessor, it's very important to also notice your biases. So every time before the assessment, then we'll be told, how we did in the last year, whether there were any biases, and then, so I think we're always watching out. So we shouldn't, like personally, I feel I shouldn't choose someone who is like me to go into med school and then exclude all the people that are not like me. I think that's not fair. But as long as you do well, I can accept.
Can I ask you a question? So, if someone in Singapore failed their interview, can they apply for medical school the next year?
Yes, they can.
You can. Do they get discounted with their marks, or they are being seen as a fresh new candidate?
That one I am not sure.
Okay.
But,
But I heard from the website is this. I mean, I read from the website.
Yeah.
So if during your first interview and during your first application and you are granted an interview which you fail, the likelihood of you getting a second interview at the second run is very slim.
Oh, why?
It's in the website. It actually said that with the exception of a few things. Yeah, so they listed down a few things of achievements from the time that you failed or was rejected until you apply again. So, for example, during this period, you may be representing Singapore in some SEA Games, Asian Games, or Olympics. You can actually put it in, and you might be considered.
Wow.
Yeah. And I have seen people who are in national service and they did very well. Whether that is truly why they get it, I'm not sure. But they put it in. So, for example, they are SWOT winner. They are Bayonet winners. So they put it in, and there they are. Not many, but it means that actually there's still a second chance. Not like what we always think there's no second chance. There's always a second chance. It's just that you need to prove why you must be given a second chance.
So if let's say this person fails the interview for NUS, do you think, how strongly would you encourage this person to go for Duke-NUS or LKC or other postgraduate medical school entrance?
For the pre-med I've advised so far, especially if they have not done anything significant from the first rejection, I said forget about LKC as well. Yeah, just go and get the degree done and then come back and apply for Duke. So there's one version. The second version is, of course, if the parents are not against it, they can actually always go overseas. So why I say that it's not just about money. In fact, going overseas is not that expensive, because there are ways out, right? No, but the whole thing is whether the parents really want to let go of the child. Sometimes a lot of Singaporeans, their parents actually are the key factors in determining whether the child go overseas to do medicine and whether they come back after they graduate. So that is really not the choice of the child itself or the applicant himself, but really between the parents and themselves, how they worked it out. So there are ways to always come back. Now so just now we were going about asking about this question about funny things, right? About interview. One of the I like I said, I have not done assessing, but I've asked the same question among all my pre-med students in the last 10 to 15 years that I've been doing this. Almost invariably, almost every applicant have a very sick person at home. Either themselves or one of their relatives. Right? When I was young, I was very ill. I went to the hospital. The doctors looked after me very well. I became well, so I want to pay back to the society, or something like that. So I always ask, didn't the nurses look after you very well too? Why didn't you become a nurse, right? Didn't the pharmacist do as well? Didn't the physio did very well as well? Why don't you do that? So a lot of biases. It's very comical. So I figured out that if everyone with this story get into med school, then all the Singaporean doctors must be very sick. Anyway, that was just one funny thought I had. Right. Okay, so since we are talking about interview questions, why you want to be a doctor, maybe it might be good to share some of the struggles that we have when we were a student, or maybe even when we were junior doctors training to be a specialist in the case of John will be a specialist in gastroenterology, and then both Kenneth and I, we did our struggle through our family medicine training and then fellowship and all that. So maybe we want to share a little bit on that and see whether give a glimpse of all this live to the potential applicants. Who wants to start first?
Sorry, what was the question?
It's a very long question. Okay, so basically
share what a specialist is about.
What struggles that we had gone through.
Oh, okay.
Everything.
I think okay, so struggle as a medical student or struggle as a doctor?
As a student first, and then as a trainee doctor.
The struggle I had as a medical student would be trying to, because I was living in a flat with other university students. The struggle I had was really after your study in library, come back home, trying to cook meals, trying to clean your laundry, do all the self-care things. And I guess in the weekends you'll be studying, and while the other, your friends from other faculties, they will be going out, hang out and have fun. I think to me, the struggle is trying to balance between study and relaxation, knowing when you need to relax, because if you don't know how to relax and you work so hard, by the time you're a doctor, it's even harder for you to learn how to relax, learn how to do things outside medicine.
Right. And I think in your case is a bit more challenging because you're staying away from home. Right. Can I talk about yourself being totally locally trained and brought up?
Well, I think the challenge for medical school training in Singapore is that number one, I'm a very technical person. So I know from when I was secondary school, JC, I love all the details. So in medical school, I was spending a lot of time reading the textbooks, trying to understand the little details about biology, pharmacology, anatomy, and you realize that some of those details may not be actually relevant to clinical practice, and it's more important to actually have like a broad-based understanding and exploration of all the various subspecialties and specialties, and so I felt that my approach was wrong at the start. The second part was also I felt that it was difficult to balance between your personal time and your studies, and so that also took a little bit of effort to get used to. Yeah.
So it's a bit of like medicine is an art and not a science, right?
That's right.
Yeah, so
Like,
realizing from your technical approach to medicine.
yeah, because you can spend a lot of time deep diving into one particular area, but you may not end up being a specialist in that area. And when they test you on the exam, it may not, be at that level of depth. So there's a lot of extra effort.
Right.
Yeah.
For personally, I find that it's kind of like a nerdy kind of traits, right? So I believe you probably have thought of it as well. I think all of us have certain liking or affinity to reading. We don't mind reading things. We don't mind studying. We don't mind taking exams. Maybe you do, I don't know.
I do mind actually.
I love taking exams,
Really?
to be frank. Yeah, I have a different mindset about that. So in my mind, it's like, since I'm studying so hard, right, I need to show the world that I've done it. The only way to show it is to take the exam, right? To pass it. If you don't pass the exam or do well in the exam, then what's there to show? All the hard work goes to nothing. Yeah. So I think it's like sounded like a cliche, especially in Singapore. Doctors need to have the attitude of lifelong learning. Actually, for that matter, it's not only doctors, everyone nowadays, but doctors in particular. So the moment that you think you have arrived, I think is the end of your career. Right? Do we think so? Right. Yeah.
But that's the annoying part about medicine as well. So because things are always changing, just because you finish reading the textbook doesn't mean that the textbook won't change the next year.
Yes.
And the guidelines will also change the next year.
That's right.
So it's actually continuous work.
Yes, correct. It is. Okay, so still on answering question in interviews, I'm not sure whether these are actually answered, question or actually answered this way, but there will always be some questions that are a bit of dilemma kind of thing, a bit hard to answer kind of thing. Have you encountered any of these questions, and if so, how do you answer them?
I should be asking you guys this question.
Yeah, have you?
Well, I think the dilemmas are very common in clinical practice, right?
Yes, it is.
So it's all about how you reason and what is the reasoning that you're demonstrating to whoever that is assessing you. Yeah. So you may approach it from ethical perspective, right? Knowing some ethical principles, or you may take a different approach, like a sociological approach, I don't know, or even a religious approach.
Okay.
But as long as you have some kind of, we always say that it's not just ethics, right? It's also morals, right? So if you have some kind of moral, if maybe you're not ethically so strong, or you have a good morality, a moral approach, I think that's also acceptable.
So let's just break that down for the audience. Ethical principle. Could we talk about ethical principle? What are the principles that you think the audience should learn when they go into the interview?
So ethical principles in medicine, generally we have a few. We have non-maleficence, right? So we don't want to do harm, okay?
Yes.
We want beneficence, so we want to do good for the patient if we can.
Yes.
Then we have, we want to make sure privacy, confidentiality, right? We want to autonomy, so which is to respect the patient's right to make their own decision for themselves, and then what else?
These are the main four.
These are
the main four.
Of course, there's also fiduciary duty, so you should make decisions in the patient's best interest.
Yes.
Right, and be honest whatever happens.
Right. Yes. Yeah. So that's one aspect of things. Morally, as you said, can be religious at their own conscience.
Yes, correct.
Right. Yeah. So since you were talking about that, right? Ethically speaking, so let's think of one difficult one and see how you answer.
Now I'm back in medical school again.
Okay, I do first because I've never done any medical interview.
Okay, you should try it with
the
assessor. The assessor.
Okay. No, you throw the question at me.
Okay,
I want to be the
Okay. So, given the COVID pandemic, right? There are many things said in the social media about the COVID vaccine. If you face a patient who is elderly, who needs the vaccine, but is unwilling to, how would you approach this?
Thank you very much, Dr. Leong, for the question. So your question was, facing the during the COVID pandemic, if a person or elderly person who does not want to take vaccine, but you know the vaccine is good, how would you approach it? So in my understanding in Singapore, vaccination is mandatory.
No, it's not mandatory.
Oh, isn't it?
No, it's not.
Oh, I failed already. But you know, mandatory for travel. Mandatory to travel.
No, even then it's not.
Yeah, it was.
During
was.
that, it was.
It was. Yeah, not now.
Yeah.
But you're talking about during the pandemic or now?
No.
Now, COVID vaccine
Yes.
is so the person would have been vaccinated already at this time.
Yeah,
completed 3 or 4 cycles.
About 3 years
Right.
ago.
So
yes.
currently,
It's not updated.
not updated,
Yes.
but it's recommended that every 6 months or every year
Yes,
people
right.
get a booster. So to
That's
speak.
right.
If the person doesn't want, I
Yes.
would follow again. I will follow the ethical principle and ask the person what is his or her understanding of the safety and the benefits of the COVID vaccine.
Right.
I will give them the pros and cons, whether you take it or not take it. What are the disadvantages and what are the advantages?
Right.
Of course, cost.
It's free.
It's free.
It's
correct.
free.
Correct.
Yeah,
And then I will ask. On balance, I will not force the issue because if I have given him all the information about the vaccine,
Right.
he or she chooses not to based on his autonomy.
Right.
I have done my job, provided that, of course, I told him follow the principle beneficence and non-maleficence.
Right. Okay. So do you think John passed?
I think it's a good attempt.
Oh no.
It's a good attempt. Yeah, I mean you mentioned some of the key ethical principles, right? Beneficence, non-maleficence.
And this feels like
Yeah.
Miss Universe contestant questions, you know?
Harder than that actually.
Yeah, right. You know, here are final 3 contestants. They ask you questions.
That one is easy. You just talk about world peace.
World peace,
This one is
yeah.
a lot harder.
Yeah.
Another one I can think of, like for example, a young girl, say 16 years old, came into your clinic to do a urine test. Urine test. We didn't say what it is.
Yeah.
Okay. And the family is your regular patients. So after the patient have done the test and left, the mother came into your clinic
Yeah.
and asked and demand to know the results of the test. How would you approach it?
Well, I think this is an ethical situation, right?
Yes.
That's talking about confidentiality.
Yes.
So whether adolescent, in this case, a 16-year-old girl, has the right to her own privacy, and whether the mother when taking care of her underage child has the right to know about any medical condition that her daughter may have. So in this sort of situation, we'll look at whether the daughter has any whether it will harm the number one is whether the daughter has any expectation of privacy, right? So if the child is very young, then definitely I can tell the parent what is the results of the test, because there's a potential that the child may not understand or be able to make medical decisions on the results of the test. But in a 16-year-old, actually, some 16-year-olds are very smart. And so then we will have to assess what is the understanding of this child, whether does she expect any privacy from her parents, right? What is the relationship between this child and this mother? And then, and in that sort of situation, probably the best approach would be to talk to the child to see, hey, your mother has asked to know about your results. What do you think about that? Is there any concerns that you have? And if there are some valid concerns and the child you feel is able to make rational decisions about her own healthcare, then I think we should respect confidentiality and we should respect her autonomy and tell the parent that, I'm sorry, we can't do that. And if we can't do that, we can't tell you the results of the test, then it would actually also follow the principle of non-maleficence, not harming the child. Of course, in between, why the child wants to keep the information private, then we can explore into that. What is the relationship between the mother and the child? and then that's where we can step in and help them.
What if the mother insisted on knowing, and then go home and make a big fuss because you said that the daughter doesn't want her to know?
Well, if the daughter no, I mean if the daughter wants to, I think ultimately if the daughter wants to keep her medical information private, I think that's something that we need to defend. Because as a medical profession, we need to make sure when patients come to see us, they know that their sensitive details, their medical conditions can be kept private and confidential, right? If the daughter is so I would say the right approach would be for the daughter to actually tell the mother what the mother wants to know.
Yes, I think so.
Do you think a pre-med student will have this kind of maturity to answer these questions based on these ethical principles they may or may not know?
Those who have gone through the tuition center probably knew.
Yeah.
So that's where you answer perfectly, you might not get into medical school.
Yeah.
I have another question.
Yeah.
Also ethical dilemma. Now, so if you were the doctor looking at, say, a case of a child actually even adult is fine, right? Who confessed to you that they vape in Singapore. As you know, vaping is illegal. What would you do?
I always tell my patients don't vape because it's bad for the stomach.
Right.
The most important thing is the therapeutic. As a doctor now, I guess if I was a pre-med, I would say, yes, this is totally wrong. We should inform the authority. I mean, not knowing all my things that I know, all my crafts now, I would say, I would have said, yeah, inform the authority because it's illegal. But medicine is never straight like that. So this is what I would do now. I would say, I will remind them, actually this is not good for your health, and it may not be, it's not legal in Singapore.
Right.
But knowing the confidentiality of the patient, I would not do anything other than advising the patient this is illegal.
Right. Yeah. So I guess it depends on what kind of crime that you're talking about. Now, so in vaping, I don't recall that is in what they call the lawyer called the Criminal Act or something like that. It's an offense, no doubt, but I think they have different grades of it. So it's different because some of the others, like for example the Drug Misuse Act, that one then is different. That one we are mandated to actually report and whistleblow. So that's a bit different. Vaping is really in the grey in a sense. It's under HSA law, but it's not under Drug Misuse Act. Okay, so there are many of these ethical questions. Maybe we should have another session talking about all this. In fact, in my head, a few more. They are very exciting ones. But I think I want to touch on something that is very pertinent, and especially post-COVID period. It's about mental health, right? So how would you advise a young pre-med student to consider or reconsider their choice in med school if you know that they have some issues handling stress? It may not necessarily be diagnosed as a case of depression and all that, but they may have issue handling anxiety and stress and heavy work, whether physical or mentally.
I think it's extremely difficult. I guess since the known time of human history, medical school is probably it has been very, very stressful. And when I was going through medicine, I know there are a lot of senior medical students who attempted suicide or have succeeded in suicide. Screening for patients or pre-med students for psychiatric illness or mental health issues is important, but knowing the severity of the mental health issues and whether or not they are fit to be a doctor is a very difficult assessment. Very, very difficult. It's a little, and then you carry that kind of judgment onto yourself as the assessor as to, I don't think you're fit to be a doctor. I don't think you're nobody can say that for anyone who deserves. You could say that you're not fit to be a lawyer. You're not fit to be an engineer. That is a very hard assessment because the person, because although mental illness is a chronic condition, the person can get better. and then
True.
he or she could be a good doctor.
Yeah.
It's just that there's a past childhood experience or whatnot caused them to have this mental illness.
So if you slightly different twist to the question is, for example, now you have a trainee that means this person is already a doctor and training under you in family medicine, and confided in you that he or she is struggling badly mentally. What would your advice be?
Well, my advice would be
Quick answer.
if a person is number one, like mental health is very important.
Yes.
Everybody has the potential to develop a mental health condition. In fact, I think most people in their lifetime will face 1 or 2 episodes of periods of stress or depression. Yeah. So number one, I think it's a very common thing. Number two is that we have to then be very careful about what our expectations are. So if we are somebody who has been struggling with a mental health condition, it has affected our performance, and because of that we are unable to meet the demands of the course, or we are unable to practice safely as a doctor, then I think we have to make a realistic decision that maybe this course or this profession may not be suitable for you. Right? Of course, nothing is I think a lot of people, they feel that they have to follow a strict timeline or a schedule. So if I don't make it this year, I'm not going to make it ever in my life. But sometimes when you're facing a mental health condition, like any other health conditions, you may need to take 1 or 2 years off just to get yourself in the right place, the right shape, and then continue on afterwards. So I think that's my advice.
No, I certainly like what you say. I feel that a lot of times especially in Singapore, or Asian parents, they always want to rush the kids to finish the university and all the training in the shortest time possible. But a lot of times gap years are not too bad, because gap years actually allow the child to reflect and think and even consolidate their resolve to be a doctor, to be a good doctor, or for that matter whichever discipline they are. Of course, life is always unpredictable. In the medical environment, of course, it has also a lot of different permutations, sometimes in between colleagues working in different profession in a medical fraternity and all that. Now, so I just thought the last 10-20 minutes we may want to talk a little bit about myth about medical school and medical profession, right? What are some of those that you can think of?
Myths.
Yes, the misinformation in the social media, no?
A doctor earns a lot of money.
Don't you earn a lot of money?
No, I still drive a Kia.
Kia is not bad,
doctors giving medicine is a very straightforward, very easy thing to do. Or that doctor knows everything. That's the worst one. The doctor knows everything, therefore you should not misdiagnose me. That's probably the most common misconception.
I totally agree with that one. And of course the money one as well. That's right. Can I forget of any myth that about the medical profession that the pre-med students or applicants should not have?
So I think first one is like what John has already said. All those things I agree totally. I think the next one is also that the expectation that becoming a doctor is like some kind of iron rice bowl that we're not going to be replaced. But we know with AI coming on board, many jobs will change in terms of their stability, their scope. And secondly is also, of course, from the patient's perspective, a lot of people feel that they don't need doctors anymore. They just need to go and search Google or search AI.
That's right.
To diagnose themselves.
Google says I have this. How come you don't do a scan? I need a scan. Can you come and do a scan for me now?
Correct. So I feel that the future practice of medicine may not be as simple or as easy as what we historically had in the past. Maybe a lot more time has to be spent with the patients, a lot more conversation and explanation and counseling, and that's probably where the future is. Another thing is, of course, a lot of patients also tell me, last time you gave me this cough syrup, why come this time it's a different one? So there's also expectation that the treatments are going to be the same over many years. And with the pace of technological change, you may see that different conditions will be managed differently year on year.
I think we have mentioned a few in the earlier part of the discussion. I think one of them is really the sense of achievement and arrival in medicine. Medicine, we really do not arrive at anything. I graduated about 34 years ago, and probably John about 20, and then Kenneth definitely 10 plus. Yeah, but I think the whole thing is that we never arrive in medicine as a medical profession, because things keep changing and all that. Yeah, so I think that's one myth that a lot of doctors, young applicants and young doctors think. The second one, I think, is also because arriving from same principle, they thought they would so-called stop all the hard work, right? Don't have to take any more exam and stressful life, which obviously is a lifelong kind of journey for medicine. Right? We never stop taking exams, we never stop learning. The next one, of course, is a lot about in medicine. We always think that we know everything, and everything about science is there, and it's like what you said just now. Medicine is rare and art, and not just the medicine, the technical knowledge itself. That part is easy, right? Yeah, it's really the human part that is difficult.
Yeah.
Right.
Correct.
Okay. Any other things before we round up? Touching on the last bit about red flags in medical school applications. Your free flow, whatever you want to say before we round up.
I think
yes.
Just echoing what you said
Yes.
previously regarding sometimes children do medicine because their parents want them to.
Oh yes.
That is probably it may turn out okay. It may turn out okay for a kid who loves do what the parents want him to do.
Yes.
But I think life is about a choice.
Yes.
A choice where you need to do something that you enjoy, and it's a passion.
Yeah.
And when I find there are a lot of people, younger kids, when they do the things that their parents want them to do, they end up getting disillusioned.
Yes.
And I have colleagues or classmates who almost want to give up medicine. In that scenario where the parents want them to be doctor. I remember I had a classmate who wanted to do medicine in high school. I even asked this person, why do you want to do medicine? Do you even know what doctors do? Do you you have never been sick and seen a GP? How do you know what doctors do?
Right.
So that person ended up almost giving up medicine as a junior doctor.
Right.
I think you have to follow your passion. You really know what you want to do in life, rather than say, let me get into this because my mom and dad said this is a iron rice bowl. I can earn a lot of money. It's a steady job. You won't get fired.
Right. Yeah. I definitely have taken students whose parents are doctors, and they privately told me that they don't feel like doing any more medicine. and they only confided in me after I promised them that I won't tell the parents. Unfortunately, yeah. Any other random thoughts you have?
I mean, I totally agree with what John is saying. Like, I feel that parents always want to tell their kids to buy last week's 4D numbers, right? But there's never a winning lottery ticket that you can just get for sure. Yeah, because the future is always uncertain, and I think students these days, they actually know better what is in store for them in the future.
And sometimes parents want the kids to do their profession that they could not do.
Oh yes, fulfilling their own dreams.
To fulfill their own dreams.
Yes,
that's the worst. That's why,
Yes.
because the kids are never the same as their parents.
I've met several of them that way also.
Yeah.
That's right. Okay, so we go into what we call red flags, right? Of red flags in medical term, of course, we all know it's all the danger signs. Once you hit that, you're out, kind of thing. So in medical school application or interview, what are some red flags that any pre-med applicants must be aware of?
I think red flags generally, if you don't feel like attending the interview, you don't feel confident, or you have second thoughts, then I think that's a big red flag for any applicant. If you really feel that you know, you're not ready for it, you don't want it, then you know, every year there are a number of candidates who actually email the school and just drop out of the process. Yeah, so you don't have to feel like, oh, everybody is going for it, so I have to go for it.
John?
Yeah.
I can certainly think of quite a few. Yeah, I think any evidence that shows that you're dishonest, I think that's a definite red flag. Yeah. Basically, if you have not done, let's say, a certain volunteer work and you claim that you have done it, or you come up with some new CCA in school and claim to be the chairman and founder, and then which never happened. That was also lying. Yes.
Yeah.
So integrity is very important for the profession, right? Yeah, I think that is a definite one. And then of course sometimes also exaggerating, not just lying, but exaggerating. So we may not have done certain thing that well, but we boost it to a different level. That kind of thing is also integrity, right? Isn't it? Yeah. And yeah.
In an interview, like you know this person wants to do medicine to end up being an aesthetic doctor.
Yes.
Or study medicine for the money. Can you pick it up?
I think so.
Yeah.
To a huge extent, we can tell. We can tell. It's very hard to fake that part of it. Yeah. What do you think?
I think at the undergrad level, it may be difficult to tell what is the ultimate motive of the student. And I think we shouldn't also judge based on appearances, because you know, you can tell from the interview process, some candidates come from more well-to-do families, they are better presented. Some come from a not so well-to-do family. But I generally don't look at them that way. But in terms of, I think as when you go through medical school, then you may start to figure out, oh, some of my friends are more interested in more high-paying careers. But I don't think that's also a negative, right? High-paying careers also come with high stress. And high risk.
And talking about this, do you think a person who is pre-med right now watching this and wants to do medicine, but comes from a less well-off family, do you think this person will be disadvantaged in the medical school interview or the selection process?
Okay, I think number one, I think they are not disadvantaged in the medical school selection process, but they may be psychologically disadvantaging themselves. So generally, we do have some candidates who actually do make it to the interview process who come from more disadvantaged backgrounds, but generally I feel that we still look at them. We don't actually differentiate them from the people who come from higher backgrounds. But what we feel is that sometimes they may feel more hesitant to speak up, or their command of English may not be as good as another candidate, and they feel like they don't want to speak.
A lack of self-confidence.
Yes, lack of self-confidence. So when they do speak, I feel that their points sometimes can be very valid, or they even do better than others.
For the matter, you talk about the family backgrounds, I think it doesn't matter whether you're rich or poor, high SDS or low SDS.
I agree.
But when we go for the interviews for the sake of the audience, I think we must be presentable, right? You must be appropriate for the context. You cannot dress or wear things that are out of the expectations.
Appropriate
not
attire.
Inappropriate attire, rather. Right? So you don't wear, say, slippers, for an interview. Not sloppily, even if it's fashionable today, but it is not appropriate for interview. I think that should be part of the advice.
And I think medical school nowadays do select students from different walks of life and people with different socio-economic class.
It seems so. I don't know whether it's deliberate, but it seems so.
It seems so, right? And I think that is very important as a doctor. When you have gone through from the bottom and up, you know how to take care of patients.
Yes, that's right.
And I think I've had junior doctors training under me who comes from very well-off family.
Yes.
Sometimes they don't understand the social impact of certain things. Yeah.
This is especially true in family medicine, isn't it? Because we really see across a huge spectrum of the people in the society.
Yeah.
Yeah. One other point I thought red flags is when we talk about some of the other conviction kind of attitude. Now, it is very easy to say I'm very committed to something, but sometimes it will show off, especially when we don't walk the talk, right? We can say we are very committed to certain things, but it may be otherwise. Like I say, I have only done postgraduate kind of interview.
Yeah.
So, for example, a candidate is very familiar or very keen to do family medicine residency. So they say, oh, GP work is very, very good, this and that. Then as we chatted, oh, my child is sick and I sent him to a PD, So obviously it doesn't match your commitment, right? If you think a GP is so good, why do you send your child to a PD, right? So not
PD as in
pediatrician, right?
pediatrician.
Yeah, that's right. Yeah. So it's kind of like doesn't gel. Yeah. So sometimes of course, by saying that, some of the pre-med students may be very well prepared and try to hide their tracks and all that, but that's beside the point. But the whole thing is that what we say, what we do must be synchronized.
Honesty.
Right?
Honesty.
It's all about honesty, right?
Yeah.
Not only honesty, but some of them may not be dishonest, but it's the conviction. It's a commitment and a conviction to the profession, right? Yeah. For example, you may say, I want to be a doctor, so then the next question I ask you, when you have fever, what do you do? Oh, I'll just drink water and lie down on the bed, Not that you need to see a doctor, but at least go and take Panadol, right? Yeah, something like that.
Okay.
Otherwise, why be a doctor? Right. Okay, so I think we are towards the end of the whole podcast and all that. Are there any last comments you want to make before I round up?
You want to go first?
I think enjoy your medical school application. It's a very fun process. Yeah, don't take it. Sorry, excuse me. Don't be too stressed about the whole process, but also don't be too upset if you don't make it through. Yeah, it's just take it as one of life's interesting, fun, and educational experiences.
Right.
Yeah. And I think I think just to sum up what we all said, I think just go in with belief and conviction. If you really want to be a doctor so badly, and you have the conviction, the high morals, believe in yourself, and if it's not meant to be, it's not meant to be. Maybe the man upstairs is a better plan for you. Yeah.
Yep. Yeah. That's right. Yeah, so I basically want to say almost the same thing that you said. I just thought I want to summarize. The whole thing is that every year there are at least 3,000, I understand, 3,000 applicants to any of the medical school in Singapore, right? And all these 3,000 are probably the top cream of the cream. Not just the top students, but the cream of the cream. Meaning that they are full scholars, full pointers and all that. So whoever did not get into medical school, with or without the interview, doesn't mean anything. Yeah. You are still good, you are still very good, and you can still do well in any profession that you actually choose to, right? And even if you get into medical school, do not get too proud. It's just the beginning of many, many years and decades of hard work. Just treasure that, right? Yeah. So nothing to be ashamed of if you can't get into medicine. But if you truly believe that you're called to be a doctor and you didn't get in, there are still many other ways, right? Yeah. So for the rest of the time, I thought I just want to mention a few things also. So for this podcast, we hope to continue, and there may be topics that we want to bring up. We will do another session. But if anyone wants to do certain topics, and can always let us know, the details will be given later on. And any other things that...
So if you want to us do any topics, just put in the comment below. Press like and subscribe.
Yeah. Thank you so much.
Thank you.
Yeah. Okay, start again.
Super long.
No, the whole thing is you don't have to do all 1 hour just like that.
Yeah.
Yeah.
You have to start cooking your thing.